Kennedy plans to oust entire health task force. HHS denies decision, WSJ report. In a move that has sparked controversy and debate, U.S. Health Secretary Robert F. Kennedy Jr. is reportedly planning to remove all members of the advisory panel responsible for determining what cancer screenings and other preventive health measures insurers must cover, according to the Wall Street Journal. However, a Department of Health and Human Services spokesperson has stated that no final decision has been made yet. The panel in question is the U.S. Preventive Services Task Force, a group of medical experts who serve staggered 4-year terms on a volunteer basis. Their role in choosing what services will be covered by insurers was established under the 2010 Affordable Care Act, also known as Obamacare. The task force's recommendations provide guidance to doctors on everything from routine breast cancer screening to drugs to prevent HIV infection. This latest move by Kennedy, a longtime vaccine skeptic, is just one in a series of far-reaching actions aimed at reshaping U.S. regulation of vaccines, food, and medicine. In June, he fired all 17 members of the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices, replacing them with 7 handpicked members, including known vaccine skeptics. The U.S. Supreme Court recently upheld the constitution of the task force and ruled in favor of its recommendation to cover preventive care. However, the task force is made up of an independent group of volunteer experts who are selected by the health secretary without Senate confirmation and rely on support from the Department of Health and Human Services Agency for Healthcare Research and Quality. In early July, a group of 104 health organizations, including the American Medical Association and the American Academy of Pediatrics, sent a letter to congressional health committees urging them to protect the integrity of the task force. The controversy surrounding Kennedy's actions raises important questions about the role of independent experts in shaping healthcare policy and the potential impact on public health. What do you think about Kennedy's reported plan to remove all members of the U.S. Preventive Services Task Force? Do you agree with the concerns raised by the 104 health organizations? Share your thoughts in the comments below. Kennedy considers dismantling health screening panel. What this means for you. Imagine waking up to the news that the officials who decide which cancer screenings, HIV prevention pills, or bone density tests your insurance must cover could be shown the door all at once. That is the dramatic possibility now hovering over the United States Preventive Services Task Force, according to 2 sources familiar with Health Secretary Robert F. Kennedy Jr.'s thinking. The task force, often shortened to USPSTF, is made up of 16 volunteer clinicians and public health scientists who comb through mountains of research on everything from diabetes and obesity to mental health and mammography. Their letter-grade recommendations carry enormous weight because, under the Affordable Care Act, ACA, any service that earns an A or B must be provided by most private insurers without cost sharing. In plain language, when the USPSTF says a screening is worthwhile, you usually get it for free. But here's where it gets controversial. Kennedy is reportedly weighing whether to dismiss every single member of this influential panel. Health and Human Services, HHS, spokesperson Andrew Nixon confirmed only that no final decision has been made on how the USPSTF can better support HHS's mandate to make America healthy again. The tension surfaced earlier this month when Kennedy abruptly canceled a meeting devoted to heart disease prevention. Task force members received no explanation and no new date, an unsettling signal that a shakeup might be coming. The Wall Street Journal broke the story of Kennedy's potential intervention on Friday, setting off a flurry of speculation in medical and policy circles. Why does it matter? Because altering the task force could reshape which preventive services remain free, which become optional, and which might disappear from insurance coverage altogether. The group already has a history of riling certain political factions. Its A grade for the HIV prevention pill PrEP, for example, prompted a lawsuit by several Christian employers who argued they should not have to fund a medication that, in their view, encouraged behavior they oppose. The case climbed all the way to the Supreme Court. In a 6-3 decision, the justices preserved the ACA requirement for free preventive care. but also agreed with the previous administration's position that the HHS secretary ultimately controls task force appointments. Translation: Kennedy can legally oust members and install new ones. And this is the part most people miss. Kennedy has already demonstrated a willingness to do just that. In June, he removed all 17 members of the Advisory Committee on Immunization Practices, ACIP, the panel that guides the Centers for Disease Control and Prevention on vaccines, and replaced them with 8 newcomers, several of whom are well-known vaccine skeptics. Kennedy has repeatedly emphasized childhood chronic illness as a signature issue, yet it remains unclear which clinical areas he hopes to influence through a revamped USPSTF. Will cancer screenings change? Could mental health evaluations be reprioritized? Observers are bracing for possible shifts that could ripple through primary care clinics nationwide. One practical concern: the task force relies on continuity and deep subject matter expertise to review complex evidence. Wholesale turnover might slow decisions or introduce ideological bias. On the other hand, supporters of the shakeup argue that fresh voices could challenge entrenched assumptions and make preventive guidelines more responsive to emerging science. Author Berkeley Lovelace Jr., an NBC News health reporter who tracked everything from COVID-19 vaccines to drug pricing battles, first highlighted these internal HHS debates. His coverage underscores how arcane policy decisions can affect everyday benefits, sometimes overnight. Hot button takeaway: should a single political appointee have the power to rewrite the nation's preventive care playbook? Or does the prospect of new perspectives justify the upheaval? We want to hear your thoughts. Do you welcome a reboot of the USPSTF, fear it, or land somewhere in between? Jump into the discussion and let us know.